So we are in a AI-driven world, and I'm talking about the ethical challenges and the doctor's role. What is artificial intelligence? I think you all know. It is a combination of these four things: machine learning, neural networks, natural language processing, and ultimately integrated into robotics. If I ask you a question, do you have any query about the capability of AI in view of diagnosing and management of a disease? I'm asking you, do you have a question about the intelligence of artificial intelligence or the capability of artificial intelligence? The answer is no. Think I will be given 10 guidelines for AI robots, and I'll be given 10 guidelines for one of you. And I'll be given the same set of questions for both of you. Who will answer the better way? Definitely AI robots will answer in a better way, right? There will be 100% accuracy, and there will be more efficacy, and there will be the speed as well. So we have no question about the capability of AI. But are there any kind of issue which prevents implementing the AI for medical care? If I ask one of you, do you use AI? The answer is yes. But if I ask directly a question, do you use AI directly for the patient management? You are reluctant to say yes. Right? Why is that? I asked this question from a lot of my colleagues, and the answer was, we are using AI, but we are not directly using it in the view of patient management. Then I ask why? What is preventing this implementation of AI in the medical field in Sri Lanka? There were some lot of beliefs, right? They think AI will overtake the role of doctors, rendering them unnecessary in patient care. In another word, they think the AI will replace doctors, right? And the other opinion is AI will independently make ethical decisions in clinical situations, and it is not acceptable. Some people think it's not ethical to get the assistance of AI while managing patients. And somebody think AI systems will not secure patients' data and maintain confidentiality. And AI technologies will not be benefit all populations equally. What are these beliefs? What is behind this? Is it the capability? Is it the skill? No, there are ethical issues. All these are ethical issues. Right? If people believe there are ethical issues behind this, preventing the implementation of AI in healthcare sector in Sri Lanka, what we have to do? We have to see whether there is truly these issues are existing or not. Right? That's why I did. I wanted to see the developing process of AI to see whether there are ethical issues or not. Are you aware about the development process of AI? It's all about developing algorithms. You know what is an algorithm? It's a step-by-step process or set of rules used to solve problems or perform a task efficiently. Lot of process involving in this developing process. First one, problem identification. Second one, data collection, pre-processing. And third one, algorithm selection and development. There are a lot of new words you might need to be familiarized with this machine learning, deep learning, natural language processing. I have heard a lot of times during these CCP activities. And fourth step is model evaluation. And fifth step, clinical integration. You see, the AI developers take those regulatory approvals, which is much needed thing. For models used in clinical setting, obtain regulatory approvals from bodies like the FDA, TGA, ensuring the model meets safety and efficacy standards. Even in Sri Lanka, they take the approval of NMRA and Ministry of Health. What about ethical and legal considerations here? They ensure the compliance with data protection regulations. such as General Data Protection Regulation, GDPR Act. It's one of a strong act in European Union. Or Health Insurance Portability and Accountability, HIPAA Act. It is in the US. It also is one of a strong act. Even in Sri Lanka, they comply with the Data Protection Act number 9 of 2022. It's in Sri Lanka to safeguard patient data and privacy. And they address any potential biases in the data or model, ensuring equitable care across different patient demographics. They make sure that it has a transparency, developing interpretable models, especially in the critical areas like diagnostic, where clinicians need to understand the rationale behind AI decisions. What about ethics by design? Developers embedded ethical principles directly into the design phase of AI projects. This approach ensures that ethical considerations such as respecting biomedical ethics, privacy, fairness, and security are part of the AI's core functionality. And involving ethics and legal experts, developers increasingly collaborate with ethicists, sociologists, and legal experts during the development process. This helps them understand the broader societal impacts and legal pitfalls. Is that all? No, there's something called ethical AI governance. They have internal AI ethics boards. Organizations have set up internal AI ethics boards to oversee the ethical development and deployment of AI projects. These boards can recommend guidelines, review systems, and ensure adherence to ethical standards. And it has external regulations as well. Most of the governments and international organizations are beginning to regulate AI development with new laws and policies. Developers follow these guidelines to ensure that their work remains compliant with evolving regulations. So, looking at the developing process, we are sure that they are at to the ethical standards, right? There should not be any ethical considerations to implement this for a medical field. Is that true? That's what developers says. Do we need to believe that? What we have to do? We have to do is give a scenario and see how it is response. Very simple, right? Key consideration in any AI developing process has 4 main steps. Collaboration. Development often involves collaboration between AI experts, clinicians, and regulatory bodies. There is multidisciplinary approach. Integration of knowledge from medicine, computer science, statistics, and ethics. Human in this loop. Many AI systems in healthcare operates with a human in this loop approach where AI assists but doesn't replace clinicians. Finally, about ethics, AI has the potential to meet the ethical standards in healthcare, and it can do so consistently. Right? This framework ensures that AI healthcare is not technically sound, but also clinically relevant, safe, and ethical. Now, we are going to check whether developers say actually truth or not. Right? What are the principles of biomedical ethics? You know, Champ and Childress, they are philosophers in USA. They formed an institution in USA in 1971 and wrote a book, Principles of Biomedical Ethics. They have defined 4 main biomedical ethics. They are autonomy, beneficence, non-maleficence, and justice. I don't need to explain these things for you. And later on, some other philosophers added confidentiality, veracity, and fidelity, but they are not commonly considered. Right. This is my scenario. This is about a true patient. I had a 30-year-old woman with terminal cancer, disseminated ovarian cancer, decided to refuse further chemotherapy. She knows she's going to die in several months. She doesn't want chemotherapy. But her family wanted her to get the chemotherapy. So what's our role? Should the healthcare team respect the patient's decisions to refuse treatment? What is the ethical principle behind this? It's autonomy. And it's crystal clear. If patient has sound mind and the capacity to make decisions, We have to respect patient decision. Right? How can the healthcare team ensure that the patient decision is informed and voluntary? We have to see the patient's capacity, right? I wanted to see my AI assistant's answer. So I entered into one of AI assistant ChatGPT, and this is the answer. I'll enlarge it for you. And it clearly says, yes, the healthcare team should respect the patient decision to refuse treatment as it aligns with the ethical principles of autonomy. It has clearly identified the ethical principle behind that. And it further says, even though the family may disagree, the patient's autonomy must be prioritized. Right? See the answer for the second questions. How can the healthcare team ensure the patient's decisions is informed and voluntary? Assess the patient's capacity. Provide comprehensive information. Allow time for reflection and document the process. See how beautiful the answer is. And he give some role for the family as well. Some kind of role for the family as well. And this is from the doctor's side. What about the patient side? I had a patient called PSCD, evaluated for high ESR and ultimately found to have multiple myeloma. In one day morning, PSCD came with a question for me. He had a lot of concerns. I took several minutes, I answered. But I want to see the answer of my AI assistant. So I asked PSCD to enter the same question to AI assistant, see the answer. This is PSCD's question. I am PSCD. I have a cancer called multiple myeloma. I'm 65 years old. My doctor told to take chemotherapy for my cancer. But I don't like it at all because my elder brother died following adverse effects of chemotherapy. And one of my uncle died due to toxicity of chemotherapy. Those were his concerns. So what should I do? This is what ChatGPT says. I'm really sorry to hear about your diagnosis and you're concerned about chemotherapy, especially given your family's history. What's that? He shows the empathy as well. Right? Discuss your concern with your doctor. What's that step? He wanted a human in this loop. He does not replace our place. Right? He wanted to take a human in this loop. And even the second ask, seek a second opinion. Again, he wanted a human into this loop without directly answering the patient. Right? Ask about the other treatment, consider potential benefit versus risk, palliative care. Ultimately, it's essential to make a decision that aligns with your values, health goals, and quality of life preferences. Right? Now, you know, we have an asset. We have artificial intelligence. It has capability, it has the intelligence. It meets the ethical standards as well. It's on our left-hand side. We have patients and healthcare system in our right-hand side. For the continuation of this loop, we have to be in between AI and the patients. Right? We have to be in the middle to deliver the benefits of AI to the patients. What will happen if we hand over the entire responsibility without being in this loop? If we hand over the entire responsibility of our healthcare system and patients to robotic doctors, what will happen? Of course, there will be some positive impacts. What are those? There will be enhanced decision making and precision medicine due to improved accuracy and personalized treatment. And there will be increased accessible to care as well. Think about telemedicine and remote monitoring, and efficiency in healthcare delivery also will be high. And it will support for ethical decision making by ethics-based algorithm and data-driven insights. But there will be significant negative impacts. There will be significant erosions of patients' autonomy due to algorithmic decision making and informed consent challenges. And there will be bias and inequality. algorithmic bias and digital divide will be there. And there will be significant privacy and confidentiality concerns due to data security risks and surveillance autonomy due to excessive surveillance. And there will be blurred accountability as well as dependence of AI. So it's sure we cannot hand over this duty and roles isolated to robotic doctors. We have to be in between that. We have our role. So clearly identify what's our role here. Here's how physicians, doctors can protect medical ethics in AI era. We have to think about patient advocacy. We must ensure that AI tools enhance rather than diminish patients' autonomy. And this involves making sure patients understand AI roles, their care, data poverty, and their preferences and values are respected in decision-making processes. Ensuring informed consent, we should guarantee that patients are fully informed about how AI will be used in their care, including the potential risk and benefits. This transparency is critical to maintain trust and supporting patients' autonomy. This will not be familiar with you. Yeah, this will be boring. But understand this is the thing which is doing by the doctors already in the European countries, Western countries, even the doctors in Indian countries, India or nearby India. They are using these things in their day-to-day life. So even it's boring, please try to understand our role. Right. Maintaining the critical insight, we should use AI as the supportive tool rather than a replacement for clinical judgment. They must critically evaluate AI recommendations and integrate them with the medical knowledge and understanding the patient's unique context. We need to vigilantly monitor AI-driven decisions to ensure they are in the best interest of the patients and do not inadvertently cause harm. This includes identifying and addressing any errors or bias in AI outputs. What about ethical stewardship? Promoting fairness and justice, we should advocate for the equitable uses of AI across all patients, populations, ensuring that AI systems do not exacerbate existing healthcare disparities. Protecting privacy and confidentiality, we must be vigilant in protecting patients' data used by AI systems, and they should advocate for robust data security. We should support the implementations of ethical auditing processes to regulate, assess the impact of AI on patients' care. What is our role in education and training? We should stay informed about the latest development in AI and its applications in healthcare. We cannot be isolated in this process. We have to know we have to know the latest update. We have to just use that. Right? We should educate patients about the role of AI in their care and guide them thoroughly any concerns they might have. Additionally, they should work to educate their peers about the ethical use of AI, promoting the cultural response or integrations of healthcare. Regarding collaborative development, we should be involved in the design and development of AI systems to ensure that these tools align with clinical needs and ethical standards. And we should work closely with AI developers, ethicists, and policymakers to ensure that AI systems are designed and implemented in ways that uphold medical ethics. Finally, emphasizing human-centered care, balancing technology with compassion, physicians must ensure the most of the role need to be played by the physicians here. So physicians must ensure that the introductions of AI does not detract from the human aspect. They should continue to emphasize the importance of empathy, communication, and the patient-physician relationship, ensuring that the technology enhances rather than replace human interactions. This is our role here, right? Unfortunately, as doctors in Sri Lanka, we have some additional challenges. Because we have resource limitations and poor technology access. I'm talking about the infrastructure gaps and digital divide. Data privacy and cybersecurity concerns are there. Bias in AI models due to data poverty. There are cultural and religious sensitivities. low health literacy and limited English proficiency. These are our challenges, separate set of challenges other than other part of the world. So we have to play an additional role apart from that previous actions. So this is the additional role for doctors in Sri Lanka. Bridging the language gap by simplified communication and translations of AI interfaces. Improving health literacy, patient education programs and demystifying AI. Advocating for inclusive AI development by collaborating with local developers and ensuring equitable access. Providing culturally competent care, tailoring communication and addressing cultural resistance to AI. Finally, collaborating with community health workers by training for community health workers and using community networks. Ultimately, the integrations of AI into healthcare is inevitable. And when implemented correctly, it can greatly enhance patient care, medical ethics, and clinical outcomes. Even though you think there are ethical concerns, there's nothing like that. If you use this proper way, it will greatly enhance medical ethics. Physicians, doctors must play a critical role in ensuring AI aligns with medical ethics, maintain human connection, and improves overall health equity. By embracing AI and taking responsibility of its use, we can lead a transformative shift in healthcare in Sri Lanka, ultimately benefiting both doctors and the patients. So, ladies and gentlemen, my dear sir, madam, and my dear friends, AI has invaded almost all countries in the world, almost all fields in the world. You might not have understand even a single word of this talk, but keep remember, even though you like or not, you have to move with artificial intelligence. That is truth, right? We can't go separately. If it might invade our medical field in a bad way, if we do not take the control of it, right? So we are the people who need to take the control of that. If we do so, we can drive our healthcare system smoothly. I'm very sure if we implement a proper system here, if we do it in a proper way, there will be huge forward shift of medical care system in Sri Lanka. So let's make the initiation and please be a part of that. Thank you. And my ultimate request is please be a human in that loop without letting AI to replace it. Thank you, CCP. And thanks for my past trainee, Arosha Disanayakasa, and current trainee, Vimal Siruvathasa as well. Thank you all again.